Impedance plethysmography, or IPG, is a simple non-invasive examination that monitors blood flow by measuring the electrical impedance, meaning the electrical resistance, of your body segments. IPG measures changes in blood volume by tracking the changes in this electrical resistance. 6 electrodes are placed on your skin, 3 on each side of your leg. The 2 outer black electrodes send a very low electrical current through your body that you can't even feel. The 4 inner electrodes measure the voltage changes caused by this current. Blood conducts electricity much better than muscles or bones, so when blood volume changes with each heartbeat, the electrical measurements change too. It's like monitoring traffic density on a highway. More cars mean different flow patterns, and IPG can detect these changes in your blood vessels. Then, Venous Occlusion Plethysmography, or VOP, takes this monitoring to the next level by creating a controlled traffic test. The patient lies with legs elevated 30 to 45 degrees above heart level to help drain the veins. 2 pressure cuffs are placed on each upper thigh. The VOP test follows a specific protocol. First, the cuffs inflate to 40 millimeters of mercury for 1 minute, then 60 millimeters of mercury for another minute, and finally 80 millimeters of mercury for the 3rd minute. At this final pressure, it's creating a controlled bottleneck. Arterial blood can still flow into the leg, but venous blood cannot flow back out. During this filling phase, the IPG electrodes measure how the veins fill with blood. When the veins are completely full, the measurement curve flattens out. The amplitude of this filling curve tells us about venous capacity. Then comes the crucial moment. After 3 minutes, the cuffs automatically deflate and all the trapped blood rushes out. In healthy veins, this outflow is quick and smooth, like traffic flowing freely when a roadblock is removed. But when a deep vein thrombosis is present, the outflow is significantly delayed. This test is particularly effective at detecting clots in the thigh or pelvis because these larger blockages have more significant effects on the overall traffic flow. The more a blood clot affects circulation, the clearer our electrical measurements become. The graphs show this clearly, normal venous outflow versus the much slower pathological pattern. However, it's also important to note that thrombosis is not the only factor that can hinder venous outflow. Other pathological changes, such as tumors and hematomas, can also contribute to this issue. These non-invasive technologies help us spot potentially dangerous blood clots by monitoring their impact on the venous system. IPG and VOP are among the diagnostic tools being refined in ThrombUS Plus, a Horizon Europe initiative to develop a wearable device for the early detection of deep vein thrombosis.